Let's take a look at the top story that we are tracking for you this hour. Health services in the United Kingdom are all set to open COVID-19 vaccination for all adults. The government has set a target of inoculating all willing adults with at least one shot by next month. Authorities have called the move a big step towards reaching that target. UK Prime Minister Boris Johnson has pushed full reopening plans to the 19th of July. Now, he has also pledged to give every adult at least one vaccine dose by the same date. Now, this step comes as the country witnesses rising COVID-19 cases. He said, and I quote, "Offering all adults a jab less than 200 days after the program launched is one of the country's greatest collective achievements, saving over 14,000 lives so far." More than 42 million people in Britain have received the first dose of a COVID-19 vaccine. This comprises of almost 80% of adults. Meanwhile, Prince Charles and UK Health Secretary Matt Hancock met the NHS staff at the Chelsea and Westminster Hospital. Hancock called on adults in the UK to book an appointment for vaccination, and when asked about whether children will be getting the jabs, he said that the government will be looking at advice from experts in the next couple of weeks.
Well, all adults across the UK can now come forward and get vaccinated. So my message to every adult who hasn't yet had the jab is come and get the jab. It's really easy and it will help protect you and protect those around you, and it will help us all on the road to recovery. If you've had one jab, you haven't had the second jab, get that second jab because we know they're so important. And because of the success of the vaccination rollout, we can be confident that we're on that road to recovery, but it takes everybody to come forward and get the jab. Health
authorities in England, Wales, Scotland, Northern Ireland run their own vaccination campaigns. Now, Wales and Northern Ireland have already made vaccines available to all adults. Scotland is offering vaccines to anyone who is over the age of 30, and the UK has rolled out Pfizer, AstraZeneca, and Moderna vaccines. Now, for more on this story, our London Bureau Chief Mandy Clark is joining us live from London. Good afternoon to you, Mandy. Thanks for being with us on this broadcast. Now, with this latest move, does the UK seem to be on track to achieve its target of the 19th of July?
It does seem that way. It is definitely doing a massive push. It does have enough vaccines, and certainly for the over 40s, they're just going to get AstraZeneca. We know that there's more than enough. So certainly the drive forward is, of course, that they should reach their goal. And they're trying to convince the groups that have been reluctant, that have been minority groups who have been cautious of the jab. They're certainly trying to reach out to them who first declined that first jab to get as many people vaccinated as possible. And now the question is whether they're going to go under 18s and reach the 12-year-olds and higher. And that is a question that Matt Hancock is currently looking at.
Right. Now, how is the country dealing with the current surge in infections due to the Delta variant? Because of this variant, the reopening has already been delayed by 4 weeks. Are there any signs of the surge subsiding?
There's not really a sign of the surge subsiding. What has been encouraging is that we are not seeing the level of hospitalizations in those ICUs, those intensive care wards, that we did see in the other two surges. So it appears that the variant is far more transmissible, and we're seeing that, but we're not seeing, and we're seeing those higher number of cases, but we're not seeing the level of severe infection leading to hospitalization. And that has been accredited so far to vaccination programs. So really what the reason why the government says they delayed was because they want to make sure people get vaccinated. They won't necessarily stop the third wave. This seems like an incredibly virulent variant, but what they want to do is get many people as vaccinated as possible. So really great vaccination variant.
Right. Also, Mandy, the reports say that the UK government would be advised against vaccinating children. And this, of course, despite the Pfizer vaccine having received approval from the UK health regulator. What do you have to add to that?
Well, there's a number of reasons why they don't believe that children should be vaccinated at the moment. Of course, they'll constantly look at the information, but the chance of severe illness and infection in children, as we know so far, remains incredibly low. And it's also it's a question of moral responsibility. Should they really be vaccinating a group of that is not at risk in any real sense when the rest of the world has not been properly vaccinated? There is a moral question there. And also that there hasn't really been data on the children having those vaccines. There are countries that are rolling out in Israel, in the US. They're going to look at that data to find out if it's really worth it. But right now, the UK is looking at the risk factors for children and looking at the lack of vaccination across the world. And right now, they don't feel like it's an appropriate next step.
Right. Mandy, thank you very much for all the latest there on COVID coming out of the UK.